Hello, everybody. Welcome to our pre and postnatal fitness webinar this morning with Profi Fitness School. If you have any questions, you can type them in chat or send them on to us during the course of the webinar. Or if you're catching up later on, you can send them in anyway, and we'll get back to you best we can. Good morning. So my name is Sarah. I'm with you today for about an hour to talk about women's health and fitness, and especially postnatal training. So I have a little PowerPoint here to go through, and I'll be talking to you as well. There's a lot more in our full course. So if there's bits and pieces that you think, oh, great, I'd love to know more about that, it's a good indication that it's going to be part of the full course. So I'll start there now. I'm going to turn off my screen so I don't have to distract you guys. Okay. And what we're going to start with is what it's like on our full course. There's slight changes after being made to this course to bring it up to date and in line with recommendations and research that's been done in the field. So women's health and fitness is a very under-researched area. A lot of the research that's been done and the research that is out there on sport and fitness has been done on males. So it's very interesting that all those extrapolations from those research or tests has been transferred and used for women. So we're not getting the optimal training ability or performance ability that we could have. Now, again, it's subjective, everybody is different, but the option to be able to compete with men is very important, that we're on the ability to be on the same level if we want. So that's just one aspect of it. And pregnancy, pre and postnatal fitness and health is another major aspect of it as well. So it's kind of the first time in a woman's life, I suppose, where we're drawing attention to the fact that there are hormones involved and that they do great things for us. And normally it's the hormonal woman kind of a idea, and it's negatively portrayed generally. But when it comes to pregnancy, we're given these allowances. So we're going to talk about those today as well. So just a little skip through here, a couple of things. Trimester. So the complete a trimester is 40 weeks. So the complete amount of time that a woman is pregnant is 10 months. So we say 9 months. It's 10 from the time of conception. So T1, trimester 1, is 0 to 13 weeks. T2, trimester 2, is 14 to 26 weeks. T3, 27 to 40 weeks. And we should have a T4 in there too, really. So post-delivery. There's a very important trimester there, which is 3 months, basically, of time that the woman needs to be given to recover, to bond with her baby, to be able to come to terms with herself as well. There's a lot after changing for a woman. And during pregnancy, it's all about you. And then after birth, it's all about baby, and you're in the corner, God love you. So you need to know as well how to help yourself and what you should need and what you should look for. So there's a lot of physiological changes during pregnancy. They happen to help the fetus, of course, and prepare the mum for labor. The cardiac output changes, and these are all important when you're working in fitness, when you're doing your own fitness levels, trying to maintain your own fitness levels, I should say, just to be aware that your cardiac output increases, and so does your CO, which is your respiratory, increases as well by 8 weeks gestation. So oftentimes before some people would even be aware that they're pregnant, there is a change in the physiological aspects of the anatomy. Red blood count increases, and that's another reason why iron is recommended during pregnancy as a supplement. It's required for the developing fetus, formation of enzymes, and increased need is needed, more so in 2 to 3 times in pregnancy. The respiratory changes, we have higher oxygen demand, and increased metabolic rate. So again, we'll go through a lot more of that in the main course and in more detail. And I'll be skimming over these as we go, not to give too much on one topic. We'll give a little bit on all. So when you're looking at the changes in posture, those are huge. And they develop over the lifetime of the pregnancy. Think about the center of gravity shifting. So we have a center of gravity that aligns us over the midline of our body. So we're in a position that requires the least amount of energy to function. That's ideal posture. During pregnancy, then there are changes in the pressure on the spine in different areas. You can imagine yourself if you think of the weight distribution of a female when pregnant. So chest gets heavier. So there's pulling forward of the shoulders, which we already have a little bit of. So extended into that. For extra pressure on the lower spine as well because of the weight of the fetus and amniotic fluid and anything else that is going on in there for the woman. So a lot is happening. Muscles are changing to compensate. And what's most important, I suppose, about this is post-pregnancy. We know what happens during pregnancy, and it's not a whole lot we can do about it. Of course, we can address our posture. So during pregnancy, there is a way that we can stand better to optimize what we've been given for that time frame. As I said, your center of gravity shifts. So things like running and where they would have been a lot easier before, you can't see your feet now and your center of gravity is pulled forward. So it's going to be a little bit different. After pregnancy, very often we go back to what we did before, or we go back to fitness that we've never done before. And rarely do we address a postural or musculoskeletal change, which is the muscles and the skeleton adaptations that have happened during pregnancy. So for post-pregnant women, very basic exercises to start with are very important. So we need to reconnect the rectus abdominis, the transverse abdominis, which is the muscle that wraps around the core like your corset muscle. It's on the inside. And that muscle is the one that stabilizes our core and gives us back that small tummy. Now, I know we all think we want a small tummy, but there's more to it than just aesthetics. It's for your function as well. Your pelvic floor is part of that, and your diaphragm, so your breathing. All of that will be after changing during pregnancy. And it's something that needs to be looked at post-pregnancy. So that we go through, I'll skim these for now, not to go into too much anatomical detail, but during the course, we go through bones and joints of the pelvis. What is important there is your symphysis pubis, that piece of like cartilage between the two pubic bones at front. That separates a small bit to allow movement of the pelvis. Horrifically, there was a case, a controversial case in Ireland a number of years ago where the symphysis pubis was cut on women. And if you're anyway aware of anatomy, ligaments, tendons, and cartilage don't heal as well, and especially if they're cut. So there was an awful lot of pain and discomfort for women. So at least we've come a little bit of a way in that we know more about anatomy, and these things tend to happen a little bit less here. There's a lot of little things here like your pelvic pain or your symphysis pubis dysfunction, SPD, which you might hear of with clients who are pregnant. If they have symphysis pubis dysfunction, they may end up being bedridden or in severe discomfort. So just movement and flexibility and mobility for those people as much as they're able to manage. Hormones are mentioned there. Relaxin, that's an important one. Relaxin is one of the hormones that's released into the body to allow for delivery, to prepare for delivery. Softens and relaxes your ligaments, pelvic ligaments and joints, but it doesn't just isolate to that area. It happens all over the body. So we can be a little bit more lax. Our joints and our ligaments can be a little bit less supported. So when you're doing movements with changes of direction, we can have a little bit less support. So again, just that's why caution is advised when a woman is pregnant and exercising. It's not that they can't do it, of course they can. It's just little things have changed, like the laxity or stretchiness of your ligaments, which don't provide the support that they used. This condition, relaxin, this hormone, I should say, is released into the body during pregnancy and can be in the body up to 12 months post-pregnancy. So with your post-pregnant clients, just to be aware that they might have a potential for overstretching. So teaching them the correct methods for stretching to only stretch to a point of tension. So if you're stretching yourself, that you don't overstretch, just to the point where you feel a release. It might feel like you can go further, which yes, you can, but it's just the laxity in those ligaments and joints. The pelvic floor, huge. Again, something we do talk about a lot more now. Generally, something we only speak about in pregnancy and post-pregnancy, because you're speaking about recovery of those areas. It is important at all aspects of our life, all stages of our life, male and female, that the pelvic floor muscles function. It helps your core function, as I said previously, and it's important for your breathing. So all of that works together. For a woman, when she's pregnant, the pelvic floor helps to prevent prolapse. Prolapse is, I'm going to be as basic as I can in the language here. I'm not sure if we have trainers or not, but prolapse is when internal organs start to come outside the body. So the idea is that the pelvic floor is there to stop that. It's like a hammock in the lower part of your pelvis, and it keeps everything in. So it needs to function. When you're pregnant, there's an awful lot of weight bearing down on that area. And that can cause things like piles, and they're quite common when you're pregnant. But post-pregnancy, then, that support needs to be regained. So pelvic floor exercises, to start with, are really essential. So as soon as the woman gives birth, she can do these. She won't want to, most likely. I can tell you from my own experience, I didn't even think of it. And especially the earlier you have a child, when you're young, you don't think of it. And yes, most people bounce back to a certain degree with young births. But as we age and as our body starts to loosen up as it is, we need to be aware of these things more. So pelvic floor contractions. How you contract your pelvic floor is, imagine you're holding in, going for a wee and a fart, okay? So the whole hammock underneath needs to be contracted. Okay, so that is the first step to see if you can do that. Can I clench and relax? Some people are better at clenching than relaxing, and both are important. So if you have a tight pelvic floor, you can have issues as well. Women tend to have, because of their pelvic shape, a woman's pelvis is wider and shallower than a man's. So we have a wider angle that our legs kind of attach at. Let's keep it simple. So the muscles on the inside of the legs can be a little bit overworked in general. So for women with tight pelvic floors, it may be a matter of adductors inside of the thigh loosening up, and then by extension, the pelvic floor. But in those situations, we would recommend the client go to a pelvic floor specialist. It's great for us to be able to understand these things, though, to be aware of them as a trainer, as a woman, as anybody in the world, just to know what's going on for people. Stabilizes your pelvis and your spine, helps the baby turn during pregnancy as well. So the pelvic floor has huge functions during pregnancy, but also after pregnancy as well. That's your pelvis that we were looking at there. And in the picture on the right, pardon me, just needed to cough. In the picture on the right, we have the symphysis pubis gap. So where that space is at the front of the pelvic bones is where that symphysis pubis is. Normal is 4 to 5 millimeters, and it stretches to 6 to 8 millimeters when pregnant. So imagine that shifting of your bones and the muscles that surround it would be a little bit of tension in that area for women. So even just to understand that is important. The recovery of the pelvic floor, episiotomy. At one point, every pregnancy had an episiotomy, which was an incision made to make the vaginal canal wider. So it's a cut in the skin and the tissues to allow more movement. It can take up to 10 days to heal, and stitches can take up to 6 weeks. As I said, at one point, everybody had it. It wasn't even whether it was needed or not. It was just easier for the surgeon to do it. Men, huh? But now it's only if it's needed. And what's important about these factors is how long it takes for them to heal. So let's go to cesarean section, or C-section, you may have heard of it. It's an incision made in the abdomen, God, my words today, abdomen and uterus for delivery. So you're cutting through skin, fat tissue, muscle tissue, connective tissue. There are layers and layers and layers that have to be cut through to get to the womb. Each layer is going to take time to heal. And sometimes on the top, we can see a scar has healed, but it's the layers underneath that may not have healed completely yet. So I have a friend who had fat removal surgery, and it was quite similar to a C-section in the scarring and the cutting. And even just to be able to explain to her as a client how long she needs to heal and recover, even if it looks on the outside like it's fully healed. The worst thing that we'd be looking at with a C-section is that we would open the scar or damage the healing tissue. So that can take 10 to 12 weeks to recover. It does not mean that you can do nothing. You can absolutely move. Intense exercise, we would recommend waiting 10 to 12 weeks. Generally, it's on the 12 side of that, the later side of that. The issue with, and I've been pregnant myself, so I count myself in this 100%. The issue with pregnant women is that we, and I'll say it as me, we don't realize how long we need to recover mentally and physically. We want to get back to fitness as soon as possible. We feel ready and fit. We just went through something horrendous, physically horrendous, and we survived it. So now we're ready to get ourselves back. And that's the hard part. The hard part is knowing how much to do, how much to hold back, when to do things. And that's what your trainer is for, to help you with that. So making sure that you have somebody who's aware of these different conditions and situations in pregnancy. I've had clients who post-pregnancy went to classes with, on occasion, it was a male trainer. And again, no reflection, because females we can be all just as bad. If we don't know about it, we don't know about it, genuinely. And if you don't go through it yourself, nearly, you can't even comprehend what the person is going through. You know that from other situations. But I've had women who've gone to circuit classes and done jump jacks, simple jump jacks, but the advanced version, or not the modified version, I should say. So where they're actually putting impact on their pelvic floor. Women talk about wetting themselves and, oh my God, it was so embarrassing, I wet myself. Absolutely common. Yeah, it happens to everybody, but your trainer shouldn't put you in that position. They shouldn't have you doing impact exercises that will put your pelvic floor under pressure. It hasn't recovered. It couldn't possibly 6 to 12 weeks post-pregnancy. So developing those adaptations and progressions for exercises so women can see the development and the progression as they go. So women who deliver through cesarean still need to engage in postnatal exercises, so the pelvic floor, because the pelvic floor stretches regardless. Your body prepares for pregnancy and birth in the same way, regardless of what way delivery happens. So there's stretching and stress placed on those muscles that carry the weight of the baby. More anatomy there. I will skip that a little bit. It's just going through the different vertebra, how much the spine is going to be taking the weight of pregnancy in different places. Again, in the full course, we'll speak about that a bit more, and more about curvatures of the spine. So very important. Posture, again, is a huge thing. So we have that pulling forward of the head. We have that anyway. So if you look at anybody nowadays, we are all starting to get that little neck hump. I see it in myself. I hate it. So you'd be trying to sit and pull your chin back. We generally are looking down at something or looking forward at something, and it's natural. Our chin starts to drift forwards and it pulls the weight of your body. So a little pull of the chin forward is going to start to distort the spinal curvature. And again, if you're doing it already in pregnancy, all that weight in the chest and the tummy is going to pull it forwards and down even more. So it's just awareness. It's not about, oh God, we shouldn't be doing all these things and we should stand up straight and we should hold ourselves properly. Yeah, probably we should, but that's not really realistic. The idea is more that we are aware of it. And when we think of it, try and address it. So I'm sitting here now and I'm trying to pull my chin back in. So it's jutting forward and I'm trying to just pull it back a little bit. A little bit of awareness for posture is much better than nothing at all. So we go through those different changes, what happens in the body during the third trimester, especially when the weight in the abdomen is pulling forwards, we have a good bit of compression in the lower spine. The pelvis, if you have a look just briefly at that picture on the left, the bones of the hips, if you look at the pelvis down there, there's a little pull forwards. Let me see if I can, yeah. So we're looking at this arch here. And it's pulling forwards as the weight distribution is changing. And all these ligaments are tightening because of that change. So all of these things are going to have a little bit of impact on how the woman feels, how she functions, and what kind of training we'd like to do with her post-pregnancy as well as during. Another one is the sciatic nerve. So if you see in the picture here on the right, the blue one, that's your sciatic nerve. So people can often complain of sciatica, or what they think is sciatica, but maybe something else, just tight muscles pressing on nerves. And again, it's from that change in the posture a little bit, in the change of the spinal posture and the pelvis. And just the distribution of muscle function during pregnancy. So there's reduced absorption of impact from the foot. That's an important one for women who want to run during pregnancy. It's not that you don't. Absolutely, you've run before you were pregnant, you keep it up as long as you want, and as long as you feel capable. If you haven't done it before, probably not the best time to start, but you could also get back into that after pregnancy, once the pelvic floor has healed. So think of that center of gravity. Not only can you not see your feet as the chest and the stomach grows, but you're pulled forwards a little bit. So your balance might be a bit off. Your foot absorption is going to be a little bit different as well because of that distribution. So your knee is going to be under a little bit of pressure. And then if your knee is under pressure, your hips are under pressure. So it's just, again, awareness, not a scare tactic. If you are a runner, as I said, you can continue as long as you feel okay. But these are the reasons why it wouldn't be the best idea to start when you're pregnant. Hormones, quick look at that. Estrogen and progesterone are big ones for women whole way through our lives. So we have progesterone here and estrogen. When we hit menopause or perimenopause, which is 2 to 12 years before menopause hits. So women can experience the symptoms of that, of menopause or perimenopause, for 2 to 12 years, depending on the female. This is just regular menopause, where we're talking about an average age of 52. Now, I don't know if you watched the soaps, I think it was Coronation Street, but someone got it very early menopause, and it can happen just like that too when people are young. It's less common, but what I'm wanting to point out here is that it's about hormones and the balance of the hormones in your body. So we're fighting these hormones our whole lives. Our cycle is based on them. Estrogen is high, progesterone is low, or vice versa, or they're out of balance with each other. So a lot going on there too. They have their functions. They're supposed to help us in different ways. I don't see how causing nausea helps us with estrogen, but it plays a role in your milk duct development. So it's important for lactating during post-pregnancy. It's good for your immune function as well. Just to mention the menstrual cycle very briefly, if you're dealing with sports people as well, you may come across amenorrhea, which is a lack of periods, which means that the body system is under so much stress from the level of fitness participation that these hormones are being impacted, and the period doesn't happen. Might seem like a great thing at some point in our lives that, oh, great, wouldn't have to deal with them anymore, but it is very important. It's a very important sign of your health, your period, your menstrual cycle, and how regular it is. So if it's not regular, or if it's missing, amenorrhea, then that's something going on in the body. That's stress on your body. Again, if you're talking about sports people, that's something that the person has to decide for themselves whether they're willing to manage that or deal with that. It's not on us at all, but just to be aware of it. So you have amenorrhea, which is lack of menstrual cycle, eumenorrhea, which is a regular menstrual cycle. So these things can come up as well. Progesterone, that's another one then. So that is involved in pregnancy to build the lining of the womb. So it's very important to sustain a pregnancy. Thickens the endometrium, so the lining of the womb itself, to create a supportive environment for the fertilized egg. And that's where we get some of our discomforts. Sorry, I'm flicking there. Breast tenderness, headaches, fatigue, indigestion, heartburn. If you've not been pregnant, heartburn, oh my God. You get to a stage where water gives you heartburn because you have so little space in your abdominal cavity because everything has been pushed up. We will go through more of that during the course as well if you are interested to look into it. Insulin, again, another important one, because we have diabetic gestational diabetes. So that means diabetes that the female can get during pregnancy. And insulin is the hormone that regulates the blood sugar levels. So diabetes type 2 is, type 1 is the genetic one that you're born with, where your body doesn't produce enough insulin to match the glucose levels in the blood. Type 2 diabetes is something that develops over lifestyle and habits generally. So it's when our body ingests so much sugar that the insulin keeps raising to meet it, and it never drops. So that when we do actually need a hit of insulin, there isn't enough to bring it to that level because it's constantly on fire, I suppose. So gestational diabetes then is conditional to pregnancy. It can happen to women who have never had diabetes before, who reckon that they are eating and drinking okay, because I was tested for it myself and I was actually exercising and everything. I don't think I had it, but the fact that I even got tested for it was interesting. So it's something that women could do with being aware of. Relaxin, we spoke about this earlier. It's the one that relaxes your pelvic ligaments, but ends up relaxing the whole body. It doesn't isolate or specify one area it's going to work on. Something to be aware of in overstretching and damage to ligaments post-pregnancy as well. So we have all these. Again, this is the course that we did previous to the one coming up. The one coming up is slightly more advanced. We talk about menstrual cycle training as well. So more women's health and fitness, including pre and postnatal. So this would be covered in a brief way as well. You're not missing anything out. But nausea, vomiting, acidity, that heartburn feeling. I lived on the most disgusting Rennies, the ones with the aniseed. Couldn't stand aniseed, but it was the only one that worked during pregnancy, and I had bottles of it lying around the house. So yeah, you'll do anything to deal with those situations. Cravings, yeah, very common too. Sometimes it's a craving to get your partner out of the house. So you tell him you want a bar of chocolate or something, and then he goes and gets it, and you get peace. So yeah. So there's some nervous system disorders as well. We'll talk about those, but carpal tunnel. So that can come up in pregnancy as well. So tingling, numbing, painful hands, building up a fluid in the wrists or edema in the wrists. Pressure on different nerve systems around the body as well. So again, coming back to the sciatica, your carpal tunnel syndrome is part of the nervous system, quite similar to that, so can be reflected in pregnancy. Okay, just going to skip on a small bit here just to important stuff. Not that it's not important, it's all important. Psychosocial requirements, again, another important area. So the mental health of the client. I'll go back to that. I do a buggy buddies class. I've done it a number of times throughout the years, but I do a class at the moment, and I have women with babies that are between 2 and 12 months, I think. Now I'm doing it through a sports partnership, so I don't select the clientele. I probably wouldn't restrict those ages quite as much, and I might have started at like 3 months. I don't know. I definitely would have had to screen the women myself, speak to them. But what's important, I find, is that the woman gets to tell her birth story. She mightn't want to, but that she has the option to and the ability to. So once you have the baby and you give birth, everybody is all cooing and awing over that baby, and you're kind of a little bit forgotten. So you get to tell your birth story, what happened, how it went about, to some degree, maybe to your partner. And then you don't want to gross him out too much. So even if he was there, but you don't get to go into detail, and you don't get to go into detail on a regular basis or more than once or with several people. And you don't get to hear what's normal and what's not so normal, what was different for you that could have been traumatic. And the thing is, every woman is different, and that's probably the most common line I'll use in any of these courses with women. We're all different. These are generalizations that can apply. But pregnancy can be quite traumatic, beautiful and amazing, and like you forget most of it. But there are things that are after happening, and women don't get to speak about it. So having a group where you can talk to other women, maybe do a bit of exercise, and more importantly, sit and have a cup of tea or coffee or something afterwards and just chat about your birth story, about how you're coping with the baby, you know, all those things. Very important, because people think it's only them that's dealing with these things. You genuinely do. You know, people are having troubles, but everybody's so happy and smiley going around with their new babies, but they don't really tell you too much about the troubles. So you don't really have anything to compare it to. So it's great to be able to get those things out and feel normal. Relaxation, very important. But do we get it? Probably not. A lot of women like to rush home out of the hospital just to be in their own comfort. And I get that, because in the hospital, you have people around you who are up all night, feeding babies at different times. You might sleep, you mightn't sleep. You're up at certain times, but they actually wake you to feed the baby every 3 hours. If you don't do it yourself, they did when I was there. I don't know if they have that much intervention now. So a lot of women like to just get home in their own space. And while that's wonderful, once you're home, you're home. And if you've other kids, they ain't going anywhere. So you just don't get that relaxation that you need. So remember, the body has been under stress. You have postural changes that we spoke about, your physiological changes, your heart rate, your blood pressure, a lot going on. So while it's something that women have done for centuries, we shouldn't underestimate the impact it has on a woman. So coping methods, to teach them or to talk to them about coping methods. That's sleeping your baby sleeping. I love that one. That's sometimes not as practical as you think. They kind of go to sleep really quick. And I don't know if your brain can switch off that quickly and go asleep for a quick hour or whatever, but sometimes that's not as easy as it's made out to be. You could do something like progressive relaxation with them, where you get them to tense and relax muscles in a progression through the body. We'd speak about that in the stress management course, but you can look it up on YouTube for a quick look at it, not our course, but that particular progressive muscle relaxation. Great technique for relaxing. So yeah, postnatal depression. I got it on both my children, and my children are 14 years apart, I think. Yeah. You kind of forget when they're that big of a gap. So one is 17 and one is 4. And when I had the 17-year-old, I had postnatal depression, but I didn't deal with it because I had depression before I was pregnant. So I didn't really know much about postnatal. That was 17 years ago. So that's changed. The second baby, I acknowledged the postnatal depression and went to my GP, and I have been on medication since. He's 4. I'm not sure if that should be the case. It's not something that's monitored very well from the doctor's side. I suppose they have so many clients that they couldn't possibly keep up with everybody. But antidepressant medication helps to balance the serotonin levels in the brain. So the happy hormones, they just help to rebalance those. Sometimes they can be a bit out of whack after having a baby. To be expected, if we think about all those hormones that have been flying around our body for 12 months, 10 months, longer, whatever it is, however long they've been going on in there, they've been disrupting things. They've been changing our mentality, how we think, how our body feels. And then all of a sudden, the baby's gone and we're expected to be back to normal. Even we expect to be back to normal. So it's just, again, awareness. Postnatal depression is real. Postnatal psychosis is another level above that again, and that's real too. So things like loneliness and isolation for women post-pregnancy are a big thing too. Sometimes you want to be on your own with your baby. You just want to live it up and not have to talk to anyone or deal with anyone, but that can kind of roll into inability or inaccessibility. You don't know people anymore. Your friends are on a different path, or people with kids that you know, the kids are different ages, you know, so it's a lot changing mentally as well as physically, and we just need to be aware of it for women. Feeling poorly about your body. Again, that's another one that spurs us back to exercise quicker than we should maybe. And I should come to that in the next slide about what exercise is recommended as well. So this is the NHS recommendations, but it is pretty much a global consensus on the 150 minutes a week. That's your average recommendation for health. So a regular client who's never exercised before, not pregnant, male or female, comes to you. The idea is that they should do 150 minutes a week. So it stays the same for a pregnant person. So we're not saying that we're invalids now that we're pregnant. Some of us are, believe me. You can have hyperhidrosis, I think that's what it's called, when you're extra vomiting in early stage of pregnancy, and that can leave you dehydrated and physically not capable of getting out of bed, fatigue, all those kind of things. And that's just one condition that can affect you. So yes, ideally we feel good. many days, and we do as much as we can, basically. No stress, no worries, just attempting to follow guidelines. It's 10 months, you know, we get through the 10 months, we get through our 3 months to 4 months recovery, and then we can start worrying about these things again to the extent that they want us to. With pregnancy, yes, it helps control your weight gain. My first baby, I ate all around me, I think. I did no exercise, I was lazy. I was a different person to the second. And on the second baby, I went to the gym. I was in fitness, working in fitness at the time, so it made it easier. But I went to the gym for as long as I could. I was determined that I was going to be the Instagram mammy with the fucking six-pack while she was pregnant. Didn't quite work out that way. I never got the six-pack since, but did manage to have it before I was pregnant for a very brief time. So, you know, that might have to do. So yeah, we can have an idea in our head about what we want to do when we're pregnant, our ideal, and then we have to manage reality. So ideally, in an ideal world, if we're not active, we start gradually, that we increase our fitness gradually, that we don't overdo it and go for a marathon run when we haven't done it before. If you are active, keep going. Listen to your body is the main one there. So adapt what you need to. Like down at the bottom here, it has it, listen and adapt. So if you were a runner, you might need to take it a little bit slower, jogging, walking as the bump develops. There's no evidence of harm for exercise during pregnancy, during a healthy pregnancy. It does help to prevent diabetes, gestational diabetes, improves your sleep, improves your mood, helps reduce those high blood pressure problems and improve your fitness. So all good. I'm going to have a little look at the picture here because there's reasons really for what's been shown. So let's have a little look at leisure there. So swimming, the elliptical, I think, is that exercise machine there. So like your stepper or your cross trainer. And dancing, I suppose, with a minimal impact as we get bigger. But those exercises would be without impact for the most part. In the water takes your body weight, or a good amount of your body weight, and makes it easier to move. So it's great for women who are pregnant. You teach aqua aerobics, and pregnant clients were common in those classes. In the gym, to take out the impact, cycling is an option. I taught indoor cycling while I was pregnant the second time up till, I say 5 months, but I actually can't remember, until I was not comfortable sitting, really. And so that's totally up to the person, what kind of non-impact exercise. But cross trainer is great. No impact on those joints that are a little bit lax from your relaxing. Out and about, she's carrying 2 bags. So yeah, you can lift things. Obviously, there is a weight maximum recommendation, but the woman is going to have to lift a baby and a car seat and a pram and all this stuff post-pregnancy. So lifting now isn't the problem, it's safely lifting and balancing it. So yes, she's 2 bags, so she's not being pulled to one side by a heavy bag. Again, it's that center of gravity that might be affected a little bit. Getting out into the air, getting out into the oxygen, really good for you. And I mentioned this in stress management as well. But Shinrin-yoku, it's called, nature bathing or tree bathing. So go for a walk in a forest. I know it sounds so airy-fairy, but it actually does positive things for our mental health as well as our physical health. Yoga. Again, yoga or Pilates would be a low impact type of exercise. So that's why it would be recommended. Just again, with awareness of the relaxing, not to overstretch, to be aware that your body balance will have changed, your center of gravity. And walking the stairs. So yeah, you need to keep those legs strong because some women will stand or squat to give birth. Even if you don't do that, you use every muscle in your body when you're trying to give birth. So my second baby, I was made, they told me what way to sit or lie or whatever, and you just had to do it. I would have changed it if I could, but I had to lie on my back and keep one of my legs in the air. Not with my hand or at, and just hold it there while pushing. I don't even know how I managed it. And I'm sure I'm not the only woman who's asked to do something crazy like that. But I have issues with my hip and those muscles ever since, of the leg that I had to lift. So yeah, there's impact during pregnancy, during birth, on our body and our muscles. And sometimes we don't see it till further down the line. Like now I'm 38, I think. So I'm starting to feel my body a bit, just a little bit, those joints and ligaments and those hangovers from pregnancy that I didn't fix, even though I had the knowledge, which is worse again. So yeah, don't assume because someone knows what they should do that they're doing it either. Our duty. There's a lack of information out there about healthcare and fitness during pregnancy. It's about giving people guidelines to work around, because they need to listen to their own body and follow their own responses and reactions to the exercise. We need to know our boundaries. We are not medical practitioners, so you have to be careful not to diagnose or to give exercises without maybe having your doctor's approval first. All of those things we cover a bit in the full course. So your best practice when you're doing classes with pregnant or post-pregnant clients, or if you're doing personal training, anything, any issue where you're working with clients, ensure that they get doctor's clearance. So the doctor needs to say that they are okay to do whatever it is you want to do with them. Generally, you get the doctor's okay at your 6-week checkup. So that's for a regular birth and a vaginal birth. All of them are regular. So vaginal birth. Post C-section, you generally have that check about 10 to 12 weeks. Now, a lot of things have changed with the healthcare system, and that might be different. So check as well with your client when they're due to have that check with their doctor. So the doctor will sign off on pelvic floor, make sure that if there's any stitches that they've been removed, areas have healed enough to return to exercise. So you need that doctor's clearance. You need to complete a health screening form relative to pregnancy or post-pregnancy. So there'll be questions you'll ask that will be different compared to your normal screening form and in those two areas of natal fitness. So post-pregnancy, you'll be asking what kind of birth they had, was there any tearing or discomfort? These are not essential questions, these are just ones off the top of my head. Number of little questions that would be different to what you would ask in your regular screening. So just something that might develop over time as well for you as an instructor. As you do a class, you might think, oh, I might put that question now into my screening form because I could do it knowing that. They need to sign and be aware of the disclaimer. The disclaimer is saying that if they don't follow your instruction and if they do exercises outside of your direction, for example, that it's no reflection on you as a trainer. You need to protect yourself. You need to make sure that they agree to follow what you're saying, as well as you giving them the things to do. You need to ensure they acknowledge they listen to their bodies. If they feel fatigued, to cease participation and seek medical attention if feeling unwell. Again, any doubt, refer it out. If there's anything, if a woman is pregnant and feels sick, I genuinely would say recommend them to go to their doctor just to check. There'd be nothing worse than not checking something and then it being an issue later on. Again, down to the woman then after that. Ensure that they're aware if they feel more tired than normal, that they can stop training on a certain day. Rest is just as important as training on occasions. Ask permission when you're touching or spotting the client. So the woman has been pregnant for 10 months, people coming up, feeling her belly, hugging her maybe from behind so they can pretend they have a pregnant belly. That's something that I do. So yeah, they might be a bit groped beforehand. So just check. Is it okay if I put my hand on your shoulder to show you? Is it okay if I do this, that, or the other? And also then check that your insurance covers you to work with the pregnant clientele. So make sure that you're covered as a trainer or an instructor as well. The warning signs to cease participation, quite obvious ones: any vaginal bleeding, difficulty breathing, dizziness, headache, chest pain, muscle weakness, pain or swelling. If that happened to a regular client, you'd stop anyway. So no different with your pregnant client. Pregnancy nutrition, quick little blast on this. So we were saying, do you have to eat for two? You don't have to. It's a perfect time to get away with it though. So, I mean, if you want to, but in the final 3 months of your pregnancy is when you need your extra calories, and you'll need only about 200 calories extra a day. So that's about 2 slices of wholemeal toast with margarine. Wow. So yeah, we can overdo that eating for two thing, but again, it is really your only chance to get away with it in your life. So, you know, I get it. Post-pregnancy, and we'll be coming to an end shortly. So about 11 o'clock, we're due to finish the presentation part. I will stay. I'm going to give you a couple of minutes to, if you have any questions, you can write them down in chat for me, or you can ask if you like, if you prefer to do it that way. But before we do, post-pregnancy recommendations, again, quite similar. So from birth to 12 months post-pregnancy. So we're saying a year of your life. It's taken almost a year for your body to change and adapt to pregnancy. So it's going to take at least that time to recover from it and bring the body back to homeostasis or balance again. Leisure, keep up that low intensity or low impact exercise. So we don't want to put pressure on that pelvic floor like we spoke about. Dancing, of course, it helps with the mental health as well. And look, babies around everywhere in all the pictures. Classes like Buggy Buddies are great because you get to meet other people, other mums, if they're brave on occasion, other dads, and just, you know, feel normal and socialize as well. At home, lifting and carrying the baby, that's a weight. Okay, it's not a big weight at the start, granted, but that child develops and it gets harder to lift them out of the car, to pick them up and move them, to put them in their cot, to take them out of their cot. So helping the woman manage that post-pregnancy would be great. So what muscles do we need to build strength in for that woman to be able to do what she needs to do in her daily life? So rather than a big bum exercise program just for aesthetics, we could look at strengthening the core, the pelvic floor, again, which is very important the whole way through. Arm exercises, upper back exercises to fix the posture, but also to build strength. You are going to play on the floor with the baby because you want them to do tummy time. You're going to be down there when you want them to crawl. So getting up and down off the floor in a correct way, even teaching those things to your clients post-pregnancy is great, or learning it yourself post-pregnancy, taking the time to learn how to get to the floor and get back up again, using your muscles, not leaning and pulling. Small things. Pelvic floor exercises, do them as early as you can and do them every day. That is the ideal. Whether you remember, that's hard enough. You have this mammy brain that happens after pregnancy where you're just mentally depleted, and trying to keep thoughts in there seems to be difficult for some people. People with more than one child, they'll often forget to bring things for the baby, like a blanket or a hat. And it's natural. It's just your brain is in a million different places and nowhere all at once. So anything you can do for mental health with fitness is going to be great. That dancing, that bringing the baby for a walk. My partner will say that that is the best time of a child's life for the parent, is when they're in the pram. They want nothing else than to be rocked and put asleep, because all you have to do is walk from morning till night. But you know, that's it. You just keep them happy. Build back up to muscle strengthening activities twice a week. So even if you've not done it before, we should start now. Balancing the body, the muscles that have been imbalanced during pregnancy, strengthening the body. So you might, walking up the stairs carrying a baby, say an older baby, not your newborn that fits in your hand, but an older baby with a bit of weight in it. That is some effort on the legs, the lower back. And if we haven't built that strength, whether it's at the gym or at home, it's going to be an extra weight or intensity on our body. So we can help with that. So a lot of things we can do post-pregnancy. Unilateral exercises. That means one-sided exercises with good posture. Again, that doesn't mean walking around with a book balanced on your head necessarily, but there is a correct posture for each exercise we do, and that exercise is more effective if we do it in that posture. So post-pregnancy, no different. Good posture, muscle building, functional muscle movements. So picking things up off the floor. The woman's going to have to pick up a pram, a buggy, a car seat, put it in a car, in a boot, pick up a baby, twist, turn with weights, the weight being the baby or the pram, those kind of things. But these are things that we can do with the woman in a gym also. So functional movements that she's going to need, and those unilateral exercises, the one-sided exercises. So if you were doing a shoulder press, rather than shoulder pressing with both arms, you do it with one arm at a time. And what that does is it, with good posture, forces the internal stabilizing muscles, the postural muscles, to rebalance. And another thing post-pregnancy is you'll carry the baby on your hip. For the most part, you'll probably carry it on the same hip. And I now, 4 years later, still have a lateral pelvic tilt, which means that one hip is higher than the other. Not ridiculously, but it leads to discomfort and pain in my hip, my knee. It will end up in my ankle and my shoulder. As I said before, being aware doesn't fix it. But for a trainer working with a pregnant client and post-pregnant client, your awareness will help them. So a farmer's carry, you know that exercise where you carry a weight in either hand and just walk. Doing that while resetting our center of gravity and muscle balance is fantastic. Then a unilateral, which is one-sided farmer's carry, which is literally just holding a weight on one side of your body while you walk. Arm is loose, so you're not holding the weight with the arm, you're letting the body carry it and trying not to be pulled to one side. So you're trying to maintain a balance while putting a weight on one side of the body to imbalance it. All of those light, small little things are fantastic for women post-pregnancy, and they don't include impact. So these are all things we can work with our clients, with ourselves. I'm going to just skip a small bit here because I've got like 1 minute left and I want to squeeze in what I can. So let's see what's really good here. Okay. During pregnancy, aerobic exercise, so with oxygen. I'm actually going to go another 5 minutes on this and still leave 25 for questions if you have them. Bear with me. I just want to get through a couple of these things real quick. So aerobic exercise during pregnancy. Try use large muscle groups. So your thighs, your glutes, rather than isolation exercises necessarily. So walking, swimming, cycling, low impact aerobic classes or fitness machines. We're talking about 3 to 5 days a week, the lower end for the novice. So 3 is loads for someone who does nothing or a little. If the person wanted to progress their program during pregnancy, the best time to do that is during the 2nd trimester. So we wouldn't try and add extra weight or extra time or extra distance in the 1st or 3rd trimesters. If the woman wants to, we're looking at the 2nd trimester being the safest. If they were previously fit, you're looking at 135 to 150 beats per minute. Beginners, 120 to 135 beats per minute. And that's very subjective. So mine was 130 at a good time, on a really good day. Duration, 15 to 30 minute sessions. If they're well trained, they can work up to 60 minutes. Early in pregnancy, I was doing maybe 30 minutes and I was fit. Not top level fit, but fit enough. 30 minutes max. 10 minutes aerobic was all I could do. And then I did 20 minutes weights and a little stretch. As I progressed in pregnancy, 10 minutes was impossible. I couldn't stay on it on a cross trainer or a treadmill because I constantly had to pee for a start. And I was fatigued. I was just tired. So it did not get to that hour as much as I wanted. There is changes in the fetus as well that we're going to look at during the course that happen when you're training and exercise training. Strength, light to moderate weights. We're not looking at heavy lifting here. Remember the pelvic floor, we all do, but you've got intra-abdominal pressure. So when you lift heavy weights, the pressure inside your abdomen increases, and that can put pressure on the pelvic floor. So it's not that it can't be done, it's just we wouldn't recommend it, especially with someone who's not done weights before or heavy weights. So light to moderate, that I have inverted commas here, I'm doing the bunny ears with my fingers, toning exercises. Using machines will help you help reduce the risk of dropping a weight, but having a spotter is important, especially for those bar weight exercises. You can do abdominal exercises. That might be an important one I should bring up here, actually. So your stomach muscles, you have a line of muscles down the front with 2 lines that are parallel. That's called your rectus abdominis. So the front of the abdomen. Those muscles stretch a little bit when we're pregnant to allow the belly to stretch. So while we can do abdominal exercises, we wouldn't be doing crunches. We wouldn't be doing flexion or anything where we would work that front abdomen muscle. So you've got muscles on the sides, so you can do core exercises, but without contracting the rectus abdominis. Again, we go through that in the course. Okay, so we don't want to have muscle disuse or atrophy. Atrophy is wastage of muscles. So to keep active as well. Again, it's only 12 months. They shouldn't waste to that degree. But even if you're bedridden, you can do some movement. Frequency, 2 to 3 times a week for strength, light to moderate intensity, 8 to 10 exercises. That is totally up to you and the client. It doesn't have to be anywhere near that number. And the type is major muscle groups. So maybe 4 exercises of compound exercises rather than isolation. Compound exercises are exercises that use more than one muscle group. Isolation is like a bicep curl. You're just using your bicep. So if you're going to do only 4 exercises, you may as well do, and this is totally off the top of my head, squats, because we're using all of our thighs and legs and our bum. Rows, because you're using your whole upper back muscles, that kind of an idea. We should also be using pelvic floor exercises. Flexibility, be careful. It should be included absolutely as part of a warm-up and cool down. After today in the afternoon, we have our flexibility and mobility course, and that one will come up again as well. But we speak about how to do warm-up and cool down stretching. There are different types for each phase, and they need to be done in a certain way, especially when pregnant. So no fast or ballistic stretches. Keep everything in control. Ballistic is swinging kind of stretches. You might see a footballer on a pitch do it when he's kicking his leg up high and swinging it. They have their place, but not when relaxing is involved. So I'm going to finish on this for today. And if you have any questions, I'll check the chat and I'll check our online as well. And you can speak up if you really want to ask anything too. So this is at the discretion of the pregnant client, their doctor or consultant. If they're given the clear, you can include abdominal exercises. So crunches and sit-ups. There has been research to suggest that they're safe in the beginning of the first trimester. After that, there's a risk of the abdominal separation. Now, the abdominal separation is not something we can avoid necessarily. It is something that happens to allow growth of the tummy. So we don't want to stop that. That's something that's natural and needs to happen. So that separation needs to happen. So we don't want to reinforce the muscles around it and make it difficult for that to happen. And it's called diastasis recti when the muscles separate. Some women after pregnancy will have that remain and need exercises to tone the muscles or tighten the muscles underneath to bring those muscles closer together and strengthen the connective tissue underneath. Again, that's something we're going to in detail in the full course. Exercises like crunches just become uncomfortable as well past the first trimester. So they're not essential, but we do need to know that there are other options available, which we go through in the full course. So for today, that was an hour and 10 roughly. So rather than take your whole morning, if you have any questions, throw them up into the chat. I have a discount code here, bear with me. Yeah, that's going to take me a moment. So if you're thinking, you can have a little think there about any questions you might have, just bear with me. I'm just circling in my chair. I'm going to dig out these discount codes while you're doing that. Should have done this at the start, but of course I have too many screens open and I closed them all. Well, that's loading. Thanks for joining me today for this. Very enjoyable. I love talking about this. There isn't enough information. There really isn't. It's becoming better. As I said, research is starting to become up to date. God, that's even a stretch. It's getting there. So I'm doing a research project for University of Limerick at the moment on the effects of menstrual cycle in eumenorrheic athletes. So that's women with regular period cycles. The effects on performance of the menstrual cycle. So how the menstrual cycle affects their performance, what happens in the body, how it affects your muscles, how it affects your recovery, all of those things. So fascinating and just more area to dig into. So once you start on this road as a woman, it's like, wow, I didn't realize there was so many differences between us and men, and that our training should reflect that really. It's not that we can't do what men do. Of course we can do anything. We could probably do it better if we were given the right tools. So the tools need to be there first. Okay, so there is a 50% discount code. The code is 50. It's only available until Monday midnight. And you'll be reminded about that again when you're sent an email after this webinar with the recording of the webinar as well. So if you didn't get to see it on the day today, you can review it later on. If you didn't get to ask your questions, send them in to me. Profi Fitness will forward them on and I'll get you an answer, of course, if I can. Just The next course for pre and postnatal is scheduled to be on the 17th of December, and that is a full day course. So it's online. You don't need to attend in person. It can be recorded and you can catch up later on that as well. So if you want any more information about the full course, please get on to Profi Fitness School. The manager will get in touch with me if there's any questions I need to answer for you. So again, one last time, 50-50-50 is 50% off the full course. I do highly recommend it. There's not many of them in the country, and I can guarantee that I am making every effort to make it as informative as possible and to back up the data with the research as well, which is important. Research isn't everything because people's experiences are very important too, but all of that is included in the research that I do. So